My name is Bethany Johnson. Today's date is August 16th, 2021, and today is Monday. So today I will be discussing the urinary system as well as showing some pictures, courtesy of Visible Body, that I have dissected of images that we are to show. And at the end of the presentation, I will be discussing a common disease that can often be contributed within the urinary system. So to get started, I will go ahead and show you the images. So the first image I have is of the renal cap, and that is this highlighted area. And what's really interesting about the renal cap is it's actually composed of 3 layers. So the outside layer would be the renal capsule. And that is actually composed of like a fibrous connective tissue, and that's the innermost layer. And why we have that is because it prevents like trauma to like it as it's like sloshing around. So that actually helps prevent that. And then we have the adipose capsule, and that's actually on the outside. It's like the outermost portion of that, and that is actually like where you would find the fat around the kidney would be the adipose capsule, and then that's actually what protects, keeping that in place, stabilizing it, and making sure that it is protected. So the adipose capsule would be the fat located around the kidney. And then the other layer would be the renal fascia, and that is a thin layer of connective tissue. Like the renal capsule is more of a fibrous connective tissue. The renal fascia would be a thinner connective tissue, and that keeps that protected within the abdominal wall. And it helps anchor each of the kidneys. So each of the kidney is made up of the 3 layers: the renal capsule, the adipose capsule, and then the renal fascia. Sorry. And like I said, one of the images also was to show the fat located around the kidney. I couldn't find any really good pictures within Visible Body to actually show the fat located around the kidney. So basically, it would just be kind of like this imaginary, the outermost portion of the renal capsule would be the adipose capsule, and that would be the fat located around the kidney that cushions that kidney and to keep it protected and in place. And then the innermost would be the renal, would just be that renal capsule. So I just wanted to discuss that. So you guys are aware of all of that. And I'll go ahead and get to the next one. Next up, we have the urinary bladder. And I think everybody is aware of what the urinary bladder does. Holds all of the urine. It's right there in center. And the lower, or the the inferior portion of the pelvis would be where the urinary bladder is located. And I believe that this is a representation of a male diagram there. And then these next images will be of the ureters. This is the left ureter. And that runs, what's really cool about the ureters is that it's connected to so many things within the body. So first up, it's actually connected right into the kidney, and then it extends all the way down and connects right into each of the lateral portions of the urinary bladder. So this would be the left ureter. And this also looks or appears to be on a male as well. And then I have an image of the right urinary bladder, and again, connected into the kidney, and then extends all the way down into the lateral side of the urinary bladder. We were asked to find the renal medulla, and these are the renal pyramids that I have highlighted here in blue. And the renal medulla actually makes up the renal pyramid. So that's why I have located that. So renal pyramids, renal medulla. And then I have an image of the left renal cortex, and the renal cortex is directly underneath the renal capsule. So I just dissected the renal capsule off of this left kidney, and then there we have the left renal cortex. And then this is an image of the right renal cortex. These are both front images. Also, the renal cortex would be on the posterior portion of this as well as the anterior. And then it looks like we have an image of the left renal vein, and that would be right here. And extends all the way to right here on the lateral portion of the kidney. And also in this picture, which I will show you a different picture as well, but within this picture we are actually also observing both the left and the right kidneys, as well as the adrenal glands. So we have the left adrenal gland and the right adrenal gland as well, but I'll get to a better image of that too. So we'll continue on with the renal veins. Now we have the right renal vein, and that extends right here, all the way here. And so you can kind of see, if I zoom in a little bit better, I don't know if my imaging is really good right here, but you can see how the renal vein extends all the way around the renal pyramids as well. Then we have an image of the right renal artery, and that is this portion right here. And I am sorry, that is not the right. I don't know why I said right. That is the left. I'm sorry, I'm looking at the computer and not at my image. So, yes, this is the left renal artery. And then we have the right renal artery. Getting confused with this imaging. I apologize. So now we have the right renal artery, and that extends right here, and it kind of branches off right into the renal veins. Now I have a picture of the urethra. And this picture right here, or this image is right here, this blue area. And this would be a representation of the female genitalia of the urethra, or the female urinary system. I'm sorry, not genitalia. The female urinary, which would be the urethra. And it's very small. So if somebody is not aware on if the image that they are viewing is a male or female anatomy, they would know that this is only a few inches. So it's very, very quite smaller than the male anatomy. So that would be a really good indicator of knowing right off of hand if you are not aware of that already. So female urethra. And then there's actually two parts that make up the male urethra, and this is the longest portion, so you can definitely see between the female representation and the male that they're very quite different, and especially in size. And so you can see that it is connected right here, and it flows all the way down, and actually the urethra is as long as within the penis itself. So in the medical field, when we catheterize a patient, it's actually quite easier to catheterize a male patient than it is a woman, just because of how the anatomy is set up, and especially with how the urethra is. We definitely use that to our advantage because it is quite easier to place by sterile technique a catheter within this. So you can see how long it is. Much, much easier for us in the medical field. And then there's another portion, and we have the prostatic portion, and that would be right here, and that's actually connected. So you see the urinary bladder right here, and then you see the ureters, and then this would be the prostate. And then the urinary prostatic portion of the urethra is right here. And then, of course, then we would have the penile portion located here. Like I said, that flows throughout the penis itself. So when we enter, or when we perform a catheterization, we are only putting that into the penile portion of that, because it is quite long, and we're able to extend that significantly as well. So that is, oh, and then again, I forgot I have another image, just a better close-up image of the left and the right kidneys themselves, and then of course with their paired adrenal glands, which are more like caps on top of the superior portion of each of the left and the right kidneys, and they're kind of like the pyramid, goldish in color. So bilateral kidneys on the left and then the right. So that, I believe, does it for the images. Now I will be discussing a common disease that can be contributed with the urinary system. The disease I actually chose today is chronic kidney disease, and I thought that was appropriate within the urinary system because the kidneys are an organ of the urinary system, and I think a lot of people have heard of kidney failure or chronic kidney disease as well, but not really sure of what it all entails or if there's treatment for it. Because you hear a lot of people about, that they have to go to dialysis. Well, what's dialysis? And, are my family member or my patient going to be okay? So I hope today, once I describe to you, and you will have a better understanding of what chronic kidney disease actually is, and if there's hope for your family or your patient as well. So just to get started, chronic kidney disease is actually a condition where the kidneys become damaged and they cannot filter blood as well as that they normally would or could. Because of this, the excess fluid and the waste from the blood actually ends up staying in the body. And because of that, it can actually lead to other health problems like heart disease and also stroke. So definitely not good, especially when anytime any type of condition or disease can end up leading to other comorbidities like heart disease and stroke. So kind of see that how a lot of the body systems are kind of working all together. As we know, a stroke would be more neuro, and the heart would be more cardio. So you can kind of see how the urinary system's actually working together with neuro systems and cardiovascular systems, which is really neat to see how our body systems actually all work in conjunction together. The disease, chronic kidney disease, is actually called chronic because the damage to your kidneys happens slowly over a period of time rather than sudden, or in the medical field we would say like acutely. So like I said in the images, we have two bilateral kidneys, and they are organs of the urinary system, like I said, and they're located in more of the medial portion of your back, and they would be just inferior, which would be below your rib cage. So what is the kidney's main job? So their main job is actually to filter extra water and waste out of your blood to actually make urine, which would lead to the ureters, the bilateral ureters. Unfortunately, with having kidney disease, this actually can make matters worse over time and can actually lead to kidney failure. if the extra water and the waste out of your blood is not able to be done correctly, like with having chronic kidney disease. So it actually can get worse over time, and like I said, it can actually lead to kidney failure because your kidneys are not working properly together the way that they are supposed to and the way that they are intended to. So if you do end up having kidney failure, you will need to have dialysis or some type of kidney transplant. And a kidney transplant would just be from like a donor. I think every time when you renew your license or you get your license, they always ask if you want to be an organ donor. And so that would mean that, you know, if a person passes away from some type of, you know, something else that wouldn't have anything to do with the kidneys, and they were going to be a donor, then they would be able to take those organs and be able to use those for other patients that have a fighting chance to be able to live. So being an organ donor is absolutely amazing. I think everybody should do it, but obviously that's a personal choice. So in order to, if your kidneys do fail, like I said, you'll need to have dialysis, or if dialysis is maybe not an option for that certain patient, or dialysis, there's nothing more that dialysis can do for you, or it's not helping the kidneys at all, you would need to have a kidney transplant. So, like I said, that would come from a special person that has passed away that has donated them after their life. So, and obviously after having a kidney transplant, that would give that patient quality of life and be able to sustain their life for a longer future with their family. So, and be able to continue life without being sick. So a fun fact that I love, because you know how I love doing my little fun facts, chronic kidney disease is actually common among adults in the United States. So I think I learned that there is more than 37 million American adults that actually have it. And the main risks for kidney disease is actually diabetes, which I wasn't too shocked by that because it seems like there's always some type of link, especially with when you have diabetes. Sorry, my screen keeps shutting off. Sorry, I apologize. There always seems to be some type of link whenever you have diabetes, how it affects so much within our body. So I was not shocked that it's actually one of the number one, chronic kidney disease is actually one of the number one risks if you have diabetes. And chronic kidney disease actually occurs in 1 to 3 people actually with diabetes. So that's actually an extremely high percentage. So definitely if you have diabetes, you definitely have to be seeing the doctor to make sure that you are healthy, getting lab tests, checking, using your glucometer to check your levels, because that is so, so important, because now we can see how that can affect so many different areas, and especially with chronic kidney disease, because that is extremely high, as we just learned. More than 37 million Americans have chronic kidney disease. That is extremely, extremely high, especially with diabetes being the number one contributor to that. So other risks that can influence chronic kidney disease would be like high blood pressure, any type of heart disease, in which we learned earlier that I said heart disease can actually be, it can actually happen from, or heart disease can actually happen from having chronic kidney disease, but actually can be a risk as well. If you already have heart disease, can actually be a risk for getting. So it kind of goes back and forth between each other. And then also hereditary, if you have a family history of kidney failure or heart disease, your chances of having it will definitely increase, and especially with age as well, the older that you get, if you do have a family history with it. If you do have diabetes, the longer that you have had it, or have had high blood pressure or heart disease, actually, unfortunately, you are more likely that you will end up having kidney disease in the future. So like I said, very important to be getting your wellness checks with your physician and making sure that you are living a healthy lifestyle, as well as being heart healthy with your diet and lifestyle. The signs and symptoms of this disease would be like excessive edema, and when I mean excessive edema, lots and lots of swelling throughout a person's body, and that would be like non-pitting edema, because pitting edema would be like if you were to push your finger into, well, actually sometimes you can have pitting edema. I shouldn't say not pitting edema. Pitting edema would be able to see all that excess fluid just by putting a little bit of pressure. Non-pitting edema would obviously be they're so swollen that you're not actually getting any pit, which would be more of like a curvature in the skin. So lots and lots of excessive edema, swelling, and that can be throughout a person's body, but it's especially more in the lower, in the legs, lower extremities, and then the upper extremities. And this happens, the edema happens because the kidneys actually can't get rid of the extra fluid and the salt or the sodium actually within the body. So, and we know if you have a lot of salt or sodium like intake of a diet, you tend to kind of bloat or get more swollen anyways. So if you have a person that is suffering from chronic kidney disease, and their kidneys are not able to filter out that extra waste and that sodium, what's going to happen? Well, it's just going to stay in the system. It's going to go through the tissues, and that's what's going to create all that excessive swelling and edema. Other signs and symptoms could be like itching or numbness, feeling tired or like a drained feeling, headaches, of course, that can happen with all types of diseases. And then definitely like an increased or decreased urination, and then like an increased thirst. So kidney disease, it's often progressive, which means that it does get worse over time, or also can make more comorbidities for other issues. And the damage to your kidneys can cause scars and would be permanent with the scars. To actually be able to obtain a chronic kidney disease diagnosis, the doctors or the physicians would need to order blood tests like a kidney function test, which you would have done like at the hospital, like by a phlebotomist or a nurse would take that lab test, and they would look for creatinine and urea, which is found in your blood, within your blood, the creatinine and the urea found within your blood. They would also order a UA, which is just more of like a short acronym for a urinalysis. And sometimes they would order a biopsy, which would just be done by a surgeon under sterile technique, obviously done within a hospital, which would, biopsy just means that they would remove like a small sample of your kidney tissue, and then they would send that tissue off to a lab for diagnosing and, or a laboratory for diagnosing and see what's causing the kidneys to not act properly or function properly. The treatment normally consists of measures to actually help control the signs and symptoms and slow the progression of the disease, because unfortunately there is no cure for chronic kidney disease, but treatment can help reduce symptoms from getting it worse. So some of the easier treatment would be like lifestyle modifications, heart healthy diet, definitely a diet in lower sodium and lower protein. If the kidneys do become severely damaged, you might need treatment for end-stage kidney disease, because obviously if the kidneys are damaged and continue to worsen over time, they're not going to work properly. So treatments, some of the treatments that would be easier for that would be like high blood pressure medications, and then medications to help lower cholesterol levels and also diuretics. And diuretics actually help pull the extra fluid out. And one of the bad things with diuretics, even though that they help us with underlying issues like with edema, is that they make you urinate a lot more, which is good for the fact that it's helping our kidneys work and helping filter out that waste and all that extra sodium. But that is one of the downfalls, and I always do tell, as a nurse myself, I always do tell my patients that when you're taking this diuretic, don't be surprised if you end up having to urinate more, because that is one of the side effects of it. But that's a good thing, because we are eliminating and omitting all of that extra edema and fluid out of our body and within our cells, so our blood and our kidneys can function and filter out everything better and the way that they were intended to. So a doctor would also, a part of the treatment, what a doctor would probably recommend a dietitian to help you finding the right diet to be able to eat. And like I said, the best thing to be able to have is a lower diet in protein and sodium. And then also, if you are in kidney failure, fluids like water that a patient should be drinking anyways would need to be monitored and reduced. Because if your kidneys can't filter the waste and the fluid out on their own, you may develop complete or near complete kidney failure and end up having end-stage kidney disease, like I said before. And then at that point, like I had mentioned, you would probably need dialysis or a kidney transplant. So again, so we have to be mindful of the treatment as well. So after we're all, so like I had said before about needing the, if you needed to have dialysis or a kidney transplant beforehand, and if we're not, or if you didn't need to have dialysis or a kidney transplant beforehand, and we've already exceeded the measures for the treatment, we've been monitoring the water intake. We've done, we've met with the dietitian for a lower protein diet, a lower sodium diet. We've taken the measures for the the cholesterol through medications. If you need to have, diabetic medications, and those have all, we've exceeded the limit of those. And then again, I like to go back and talk about how if the kidneys are still unable to filter the waste and the fluid on their own after we have exceeded all of the necessary treatments that we could have, because like I said, there is no cure, then you would go into complete or near complete kidney failure and end up having end-stage kidney disease. And of course, there is no cure, especially for end-stage kidney failure. And you would, at that point, again, like I said, would have to have dialysis to survive or have a kidney transplant to survive as well. So I know this is super long, but had so much to share. So thank you so much for watching, and I appreciate it. Have a great day.